Good day everyone, I am Ronalyn P. Madlambayan, a student nurse from San Sebastian College, Recoletos de Cavite. For today, I will perform a head-to-toe assessment or a complete physical examination. So prior to conduct this procedure, we need to explain first the physical examination to our patient. Because explaining this to our patient or client, it helps to alleviate the anxiety and promotes cooperation and ensure the patient privacy and comfort. Good morning po. Hello sir, good morning. I am Ronalyn P. Madlambayan, a student nurse who is caring for you today. What do you want me to call you po? Okay, Sir Kaden. Ngayon po ay I'm here to order to perform a physical assessment or a head-to-toe physical examination. It's okay with you? Okay. So after the explanation to the patient, the procedure, so the next thing we do is to instruct the patient to void if possible. Because emptying the bladder increases to patient comfort during the examination. And don't forget to perform a hand hygiene. So because hand hygiene is important to defer the risk of microorganism transmission. And next, the next step is to help the patient undress or provide a gown. Because having the patient gown, mas nakakatulong sa atin na ma-assess natin ng mas madali yung body areas ng patient. To start the head-to-toe assessment, I will be starting by obtaining your height, your weight, and checking your vital signs. And aside from that, I will be also checking assessing your head, your neck, your facial features, your heart, your lungs, and your abdomen, and also your lower and upper extremities, and neurological functionality. So why do we need this po? Or bakit kailangan natin ito gawin? So, in order for me to ensure that there are no signs of abnormalities and that everything is normal. And if there are any signs of abnormalities, you're going to load that back in order to prevent further complications. For to start po, I will be performing first proper hand washing. So sir, we're going to start po by obtaining your height. Stand straight po sir. Tayo ka po na ayos. I-ano mo yung paa mo dito. Yan. Harap po sa akin. Wait lang. And then sir, next naman is your weight. Stand straight. Sir. So after that, the sixth procedure is to assist the patient onto the examination table to have proper positioning to facilitate the examination and perform a physical examination to starting ahead and working in a systematic fashion. So proceeding in a systematic fashion, it promotes organizing and efficiency. And the next one is to inspect the head and noting hair color, texture, and distribution. And then, I will palpate the forehead to the posterior triangle of the neck. And this technique can detect asymmetry and the size changes. So, sir, pupo tayo dito. Dahan-dahan po. So the next step is palpate the front and behind the ears under the chin and the anterior cervical lymph nodes. So this technique can detect enlarged lymph nodes. And the next step is to palpate the thyroid gland because palpation reveals thyroid enlargement, tenderness, or nodules. So sir, good morning. Again po, ipapalpate ko po ang inyong cervical lymph nodes. So kung may pain or discomfort po kayo nararamdaman is magre-react lang po kayo. Okay ba po yun? Okay sir. Okay po. Sir, so ngayon po ipapalpate ko naman ang inyong thyroid gland. So magre-react lang po kayo like kung may discomfort or pain kayo na nararamdaman. Okay, sir? So the next step is have the patient touch his or her chin to chest and to each shoulder and each ear to the corresponding shoulder. And then tip the head back as far as possible. So this action evaluates neck range of motion. And the next step is have the patient smile, frown, and wrinkle her forehead and puff out cheeks. Because this maneuver evaluates the motor function of the facial nerve. And then the next step is unclude the nostril externally with a finger and while the patient breathes to the other. And then repeats for the other side. Because this technique can detect edema inflammation and excessive drainage. Sir, gagawin naman na po natin ngayon is yung chin mo to your chest. Touch mo. And then your chin to the right of your shoulder. Your chin to the side po. Okay, and then naman sir, yung ears naman po, iaano mo sa shoulder mo. Then sa kabila po. Very good. So ngayon naman ay smile without showing your teeth. Patingin nga po, smile na hindi mag-show yung teeth. Smile with showing your teeth. And then puff. Puff po. Frown, and then wrinkle your forehead. Yan, very good. Ngayon naman po, sir, ang gagawin naman po natin ngayon is itatouch ko yung nostril mo and then magre-react if may discomfort or pain na nararamdaman. Okay ba yun? Okay, itatouch ko na ha. May discomfort po ba? Sa kabila naman, may discomfort po ba? Okay, wala. Very good. So, palpate the nose and the frontal and the maxillary sinuses. Palpation of the nose, it helps to detect structural abnormalities. So, sinus palpation is used to elicit tenderness which may indicate the sinus congestion. So, papalpate ko itong nose mo ha. Tingala ka po konti sa akin. Papalpate ko nose mo. May discomfort po ba, sir? Okay. Inspect the oral mucosa, gum, teeth, tongue, and salivary gland, and opening using a tongue blade and pen light. So this technique is evaluates the condition of the oral structure. So sir, harap po sa akin. Check ko po ngayon ang inyong mouth. Say Okay. So sir, papasok ko lang doon sa bed lang ha. Okay, wait lang po. Ganun ka po sir. And then, move the patient's eyes through the 6 cardinal position of gaze. So this testing evaluates the function of each the 6 extraocular eyes muscles. So next is to inspect the external eyes structures, the conjunctiva and sclera. And then the next, examine the pupils of equality of size, shape, and reaction to the light accumulation. So this technique assesses the cranial nerves 3, 4, and 6. Bali sir, ang gagawin naman po natin ngayon ay yung 6 cardinal position of gaze. Okay? So susundan mo lang ito na hindi gumagalaw ang head mo. Okay? Ulit. Balik. Kung hindi po nagalaw ang head, upper, baba, ulit, upper. Very good. So next naman yung structure ng eyes mo. Close your eyes. Close your eyes mo po. Very good. And open your eyes. Tingin lang po sa akin. Tingin lang sa akin. Sa kabila. Sa kabila naman po. Very good. And after that, inspect the ear and palpate the mastoid process. So this technique evaluates the structures of the external and middle ear. Okay? So open your mouth, close, open, close, close. Very good. So sir, ngayon may whisper akong sound or word, and then, i-repeat mo kung ano yon. Okay, ano po yon?
Dog. Cat.
Very good. And then, inspect the posterior thorax. Observe the skin muscles of the spine. So, shoulder blades and back as well as the symmetry, expansion, and accessory muscle use. So, on this, observations provides information about lung expansion and accessory muscle of during respiration. And next is to palpate over the spine and the posterior thorax. So palpations detect in the spine and helps detect musculoskeletal inflammation. And lastly, assess the respiratory execution and tactile firmitude. So ask the patients to repeat 99 and assessing firmitude provides information about the content of the lungs. So sir, tayo po tayo. Dito po. Talikod po sa akin. Then yung damit po po. Okay. Inhale. Exhale. Inhale. Exhale. One more. Inhale. Exhale. Stand straight. So, sir, balik sabihin ko yung word na 99, i-repeat mo lang, okay? Please lang. 99. 99. And after that, the next is auscultate the lungs through the posterior of the patient's breath, slowly and deeply through the mouth. So lungs auscultation, it helps to detect abnormal fluid or mucus accumulation in the anterior thorax. So sir, i-auscultate ko na po. And then, repeat the steps 20 to 23 for the examination of anterior thorax. So, sir, harap ka po sa akin. Lagi, ano ito, exporting ko lang. After that, inspect, then palpate the breast and axillae with the patient's hand resting on both sides of the body. And place of the hips, then raise above the head. So this technique, it evaluates the general conditions of the breast and helps to identify rather the any abnormalities. So sir, now So sir, it's okay with you to if I palpate and inspect your breast and axillae? Okay. So can you raise your hands like this? And then sit straight. Okay, before that, before I palpate or inspect your breast and axillae, may I invite you to lay in bed? Okay, wait lang po. So, before that, I will put this towel on this bed. Come here na po, sir. Wala na po. Okay. Yan, very good. Raise your hands like this. Before I will palpate your breast and axillae. Yan, I will pakitaas na po natin yung damit. I will palpate your breast and axillae in the circular motion. Yeah. Okay. So after that, by the assess the abdomen by observing contour, inspecting of skin characteristic, symmetry, perithalsis, and pulsations. So by observation this, it determines the shape of abdomen, and the next is visualize the 4 quadrants, the auscultate of all 4 quadrants, and before percussing or palpating. And auscultations detect the presence of vowel sounds indicating perithalsis, and next one is the palpate the all 4 abdominal quadrants. And palpations provide information about the locations, size, and the conditions of underlying structures. So the first thing that we do is to inspect the abdomen for any signs of discoloration. So okay sir, okay lang ba itaas ko damit mo? Okay, thank you. After the inspect of abdomen, so the next thing is to auscultate the 4 quadrants of abdomen. So sir, I auscultate your abdomen. So after the auscultation, I'm going to do the next is to palpation. So in palpate the 4 quadrants of abdomen, we are trying to assess for the any signs of tenderness or something like pain. So sir, if may discomfort or may masakit po, magre-react ka lang ha. May discomfort po ba? So after that, the palpate and auscultation the femoral pulses in the groin. So this technique assesses the vascular patency. And the next is to inspect the external genitalia and rectal area. And the next one is to examine the arms and observe the skin and muscle mass. So by observation of this, the skin it's provide information about hydration and circulations. And the next one is ask the patients to extend their arms and forward and the rapid turn palms up and down. And the next one is to inspect and palpate the fingers, wrist, elbow, and joints. Then palpate the hands and then check the skin turgor. So this technique it's help to provide information about the deformities and tenderness or pain. And the next one is palpate the radial and brachial artery or brachial pulses rather. So this technique it helps to evaluate peripheral vascular status. And next is to inspect the color, shape, and condition of the nails. So by checking the capillary refill. And the last one is have the patient squeeze the two of your fingers placed on the palm of the hand. So bali sir, inspect ko lang ang arms mo. Ganito po. And then your radial and brachial artery. Also your nails. Kabila po. Okay, thank you sir. So after that, examine the legs, inspect the legs, and the color of the legs if have lesions or varicosities, hair growth, and nail growth. And then the edema and muscle mass. So in this inspection, this it provides information about the peripheral vascular function. The next is test and pitting the edema in the pretracheal area and palpate the pulses in skin temperature of the posterior trachea and dorsals, pedis, and popliteal area. So assess the patient's deep tendon reflexes. And after that, stroke the sole of the patient's foot with the end of the reflex hammer and observe the patient as he walks with a regular gait on the toes, on the heels, and the heel to toe. So this procedure evaluates cerebellar and motor function. And then the last one is perform a Romber's test and as the patient stands straight and both eyes closed and both arms extend with the palms up. So sir, may I invite you to stand up? Okay sir, come here. So sir, titingnan ko po yung lakad nyo kung regular gait po ba. Okay, gayahin niyo po ako. Lakad po tayo. Pabalik po sir. So sir, ngayon naman po ay maglalakad po kayo ng nakatow. Ganon. Okay, lakad po. Balik po sir. And then ang nakatoes po. Lakad po na nakatoes. Balik po dito sir. Okay, very good. So ngayon naman po, mag-heel to toe po tayo. Alam mo ba yon? Okay, ngayon Anyway, sir, bali ayun na po lahat ng physical examination nyo. And ngayon po, mag-wait na lang po tayo for the result or readings or ano yung magiging findings po. So, ayun lang po lahat. Thank you po and see you po sa next check-up. Bye-bye po. Thank you. Bye. So, after the assessing of all from head to toe, we are now done with the complete physical examination. And after that, we can now proceed the documentation and referral. If we have any abnormalities while doing the assessment, we want to refer those abnormalities in the healthcare providers. So in order to have a further evaluations of the outcome, and afterward, we are now done with the assessment. Again, I am Ronaline P. Mandambayan, a student nurse from San Sebastian College, Recoletos, Cavite. So that's all, my return demonstration in head-to-toe physical examination. So thank you for watching.